Chapter 24 specifically gets into the business side of healthcare, and you have individuals that are running essentially the overall um, business side of all the services that are being provided. Piedmont has a healthcare administration degree that combines both the healthcare knowledge with the business courses that are also offered here so that individuals feel comfortable being in some of the roles that we'll describe here. Um, so the work description here is fairly general. Okay. Um, Again, this operates somewhat similarly to a private business where you have a hierarchy of decision makers. So you have a person who is the CEO, you have a person who is the CFO, you have vice presidents, you have assistant administrators. Um, so it looks a lot like a private business setting. This could be someone involved in managing an entire facility, so this would be someone who's essentially an executive. They could have a healthcare background. They could have primarily a business background. They could be a doctor who has an MBA. You never know. You could have individuals managing specific departments, offices, or groups. Um, so some examples of some of the titles we might see in this chapter: a nursing home administrator, a CEO, a clinical manager of surgery, a health information technology manager. And so I've included some examples. If you click on the two YouTube videos that are located below, you can see some examples of what these individuals might do on a daily basis. In terms of the overall knowledge, skills, and abilities, things like public relations, personnel management, equipment knowledge, emergency plans, communication strategies, both up the chain and down the chain. So, how do CEOs communicate on down through to the lowest levels? How do those lowest levels then communicate back up? Some of these individuals have to have a lot of financial sense. If you think about the current situation we're dealing with, clearly there has to be a lot of financial sense when it comes to this. Some of this is marketing. So we see big billboards on the side of the road for healthcare organizations. That's done by people in these roles that we're talking about in this chapter. You may have to have an individual who's capable of labor relations. Nurses, in many cases, are part of unions. Healthcare administrator has to be able to have those that ability to be able to relate to those unions. These individuals have to be able to set policies and procedures. So you have to be conscious of changes in things like laws or regulations, technology. So a lot of the things that in healthcare positions we haven't talked about at all, really in detail, these individuals have to be very conscious of. In terms of the overall work environment, you'll see based on the pay, these individuals are on salaries and they're probably going to work very long hours. According to the statistics, 3 in 10 work more than 40 hours per week. Again, these are CEOs, these are people in administrative positions. A lot of these places operate around the clock. A hospital might work around the clock. Administrators may have to be called in to deal with emergencies because they run the facility. They may have to travel to attend meetings or inspect facilities. And so, this, as much as it is kind of your standard salary job, it is not standard hours. Okay. As far as employment opportunities, a lot of jobs. Okay. Almost 500,000, 406,000 jobs as of 2018. And you see the steady growth. Again, a lot of these facilities are run like businesses. They need people with this kind of background in terms of management, in terms of business, and most people in healthcare jobs don't have this background. Okay. Um, about a third are in hospitals. That's probably not surprising. About 21% were in some type of office of physicians or a nursing or residential care facility. um, a lot of the physicians who want to have their own private practice, they don't have the business background, so they hire someone to be an office manager for them. Very common. Okay. There are a number of other potential locations where these individuals could work: home health care, federal government, working for, for example, Medicare or Medicaid. You could have outpatient centers. These people could work for insurance companies, and a variety of other areas. One of the key pieces is in many cases, you'll have individuals in these roles with some type of undergraduate degree in a healthcare related field like healthcare administration that will then get a master's degree like an MBA, or vice versa. You'll have an individual get a general business undergraduate degree and they get a master's degree in health services administration or something like that. Um, a lot of this is dependent on setting. There are certifications where a person can specialize. Um, and so nursing homes, they in many cases will require that specific certification to work in that type of a setting. Currently, there are 95 schools with master's degrees in health services administration as of 2016. Armstrong University has one. Central Michigan has an Atlanta satellite office that offers this degree. Clayton State, Georgia Southern, Georgia State, Mercer, UGA, Valdosta State all have a health services administration master's degree for individuals wanting to go into this. In terms of the overall earnings and trends, obviously the trends are positive. 18% growth in the current time frame, and that's consistent with the previous time frame. So very consistent growth, very steady jobs here. Again, hospitals will continue to be the primary employer, but we do see some very fast growth in offices of health practitioners. So again, doctors, uh, maybe even nurse practitioners, if they're going to have their own office, they would hire a manager to take care of all the paperwork and other things like that. Insurance companies will continue to employ these people. The pay is pretty good. Okay, $99,000 a year on average, and very steady growth. I mean, in only 10 years, $20,000 has been added to the average wage. There's a significant range here, though. Okay, in many cases, some of the smaller office managers, they're going to be making around $58,000 per year or less. The top 10% could make $175,000 a year if they're in a very lucrative type of position. The average healthcare CEO makes about $160,000 a year. So a lot of potential here for people to make a lot of money, but there's a lot of stress that comes with this. Long hours, major responsibilities, major potential issues in terms of lawsuits and other things like that. So these are people that have to have a very large scope in terms of their overall skill set. They need to not only understand healthcare, but they need to understand the business side of all of this. Okay. So that's chapter 24. If you have any questions, refer to your book, refer to the PowerPoint, and let me know if you have questions or concerns. See ya.